Well, when summarizing the major results of the GALLIUM trial and the aspects of the different chemotherapy backbones in that trial, one first have to say that this was a head-to-head comparison of Obinutuzumab versus Rituximab during induction and also during maintenance on the backbone of 2 or 3 different chemotherapies. The selection of chemotherapies was not based on a randomized comparison, but rather each site had to decide upfront how they wanted to treat their patients, which means that we did have a kind of imbalance in the patient characteristics between the different chemotherapies, in that we had more patients at higher age in Bendamustine and CVP-treated patients, but on the other side, more patients with high-risk features like high-risk FLIPI and bulky disease in CHOP-treated patients. Well, with that kind of precaution, when we then look at the data, we see that in all 3 chemotherapies, we see a significant advantage in favor of G as compared to R. So G-Benda, G-CHOP, and G-CVP did better than the respective R arms. When we look into the results in more detail, and when we look at the results at the end of induction, we see very high overall response rate and complete remission rates in Benda and CHOP-treated patients with minor differences between R and G, but we see substantially lower response rates in CVP-treated patients. Well, in terms of the side effects, we see more severe side effects in CHOP-treated patients, and particularly also in G-CHOP-treated patients as compared to R-CHOP, in terms of more neutropenia and also more infections. But when we then look at really severe and in particularly side effects with a fatal outcome, we had much more deaths in patients who were treated with Benda, and there was not much of a difference between R and G. We in particularly had also a higher rate of infections in Benda-treated patients. And when we looked into the reason why this is the case, we saw that when we look at the development of T-cell counts over time, we see a significant depression of T helper cell counts already during induction, but there was a prolonged dip which expanded up to 30 months before it really recovered. And that was a development which we did not see in CHOP or CVP-treated patients. And with that in mind, this might at least in part explain why we saw also the majority of infections occurring in maintenance or even longer follow-up in Bendamustine-treated patients as compared to CHOP or CVP. So let's say when we summarize the results, first of all, we can confirm the GALLIUM data for the overall group with a longer follow-up of right now more than half a year, which means G is superior, and G is superior in all 3 chemotherapy arms. We see a different pattern of side effects with more acute toxicity, particularly in G-CHOP-treated patients, but we see more and really severe long-term side effects, particularly in Benda-treated patients, with a higher rate of lately occurring infections. Some of them were really fatal. And we also see a higher rate of secondary malignancies, which means I think in the future we have to be a little bit more cautious in making the indication for different chemotherapies in different patients. I'm not saying that Benda is a bad drug, but it's not the easy drug that we thought about in the past. And I think we really have to reconsider to whom and when we apply patients Bendamustine.